Proponents out in the hallway. Any more proponents out in the hallway?
Mr. Chairman, members of the committee, good morning. My name is Todd Bergland. That's B as in boy, E-R-G-L-A-N-D. And I'm a family physician from Whitefish who opened a direct primary care clinic there in January 2020 called Fountainhead Family Med. I'm with you today representing myself, my patients, and the Montana Direct Patient Care Association, of which I'm currently the president. My objective is to illustrate for you the worthiness of the direct care model, though parenthetically, I've just made a big understatement. Really, it's unbelievably awesome. I graduated from medical school in 2002, then spent 7 years as an active duty U.S. Army physician, one of those years at war in Iraq. I left the Army in 2009 to move to Whitefish with my then 3-month-old daughter and my wife, who incidentally currently commands an Army Reserve Medical Support Unit here at Fort Harrison. After spending 10 years as a partner and owner at an independent primary care clinic in Whitefish, I left that clinic at the end of 2019 to do direct care. I've served on the North Valley Hospital Board of Directors since 2014, and in addition, since 2016, have served as a member of the Board of Trustees for Kalispell Regional Healthcare, soon to be known as Logan Health. I therefore have 12 person years, if you will, of experience on hospital boards. I assume you've all heard the Deming quote, "Every system is perfectly designed to get the results it gets." And the discouraging or even infuriating results we've been getting in primary care within the traditional U.S. medical payment system are well documented. 7-minute visits, providers seemingly paying as much or more attention to computer data entry than their patients, inflated prices, sometimes grossly so, that at the time of service are difficult or impossible to obtain, and a mindset that the doctor's brilliance is so impressive that few minutes of his or her advice compensates for the fact that there's often little time or effort put toward actually caring for the patient. Now, I can tell you it is possible to be a caring, thorough provider in that system, and there are many, but one must swim mightily upstream against the system to do so. My life as a partner in an independent clinic was not bad. I was able to modify some things about how I worked so that I felt relatively good about the care I gave my patients. But I never became okay with how the payment system worked. I heard the following statement several times from patients. "You know, Doc, I'm paying more for my health insurance premiums than I am for my mortgage, and I still have a $5,000 deductible. I'm going to be paying out of pocket for this test, so do I really need it?" A parent bringing a child in to see me for a fever and sore throat, which from my perspective was usually a straightforward visit, would walk out with a $150 or $200 charge, which was going to be paid out of pocket unless they had met their deductible. I eventually developed the opinion that our civilian medical payment system puts doctors' and patients' interests at odds with each other and does not fairly serve the patient. Now, I didn't embark on a medical career with aspirations to do a lot of computer data entry for an insurance company, and more importantly, I didn't become a doctor in order to ruthlessly drain my patients' bank accounts. Since opening my direct care clinic a year ago, I take care of my patients in a manner that makes sense to me and to the patient. I'm directly accountable to the patient and nobody else. I visit my patients in the hospital, I answer their email questions, I do house calls if needed. I have time for them when they need to come in. Now, this manifests in small and large ways many times every day, but to give a few examples, last week I spent an hour and a half with an elderly couple discussing his early dementia and both of their concerns around it. Last spring, I cured an uninsured gentleman of hepatitis C. Of note, the infection had been present for years. He had been seen in both urgent care and primary care clinics before joining my practice, and so there had been opportunities to treat him previously. That accomplishment, though, saved him from the likelihood of a variety of really awful complications, as well as the rest of us from being responsible for hundreds of thousands, if not millions, of dollars in hospital care for those complications. His membership with my clinic costs $70 a month. And to draw a contrast with the example earlier of a child with a sore throat, last spring on a Sunday at about 1 p.m., I received a call from a concerned father that his daughter might have strep. We discussed her symptoms. I offered to meet them at my clinic in an hour to take a look at her and do a rapid strep screen in the office. But he felt reassured talking through it with me. He knew he could reach me again later if the situation worsened, and we agreed to have her come see me first thing on Monday morning. It turned out, though, she had improved somewhat by that next morning, and they canceled the appointment. So in the usual medical system, a likely hour-plus wait for an irritable child and a parent on a Sunday afternoon in urgent care, an uncomfortable throat swab, and a $200 charge, compared to a brief discussion on the phone with her doctor and a reliable backup plan, resulting in no need for a visit at all, at no extra charge over her $20 monthly membership fee. Now, this is not smoke and mirrors. I have many fewer patients than I did in the insurance-based world. I have offloaded the excessive time and effort spent on insurance bureaucracy, and I don't pad my clinic schedule with needless visits in order to generate revenue. From these 3 points, then, what follows is that I can take care of problems efficiently. I'm available for patients when they have questions, and when a patient needs to come in for a visit, I have time to care for them in the manner I would want for myself or my family. And by the way, this is a photo from my website of exactly what an appointment looks like in my clinic. Note the absence of a computer. So if one question you're considering today is whether the direct care model is worthy, then it's not even close. DPC is a system, perfectly designed, to allow the doctor to provide flat-out, know-it-when-you-see-it better care, like most of us probably imagine or remember from the days of the old-time small-town family doctor. In fact, the doormat to my clinic states, "Welcome to part of the solution." The direct care model is a significant piece of the solution to several of the deficiencies in our medical care and medical payment system. And as a person trusted by your constituents to help solve their problems, I hope you will appreciate that and support SB 101. Thank you.
Thank you. For the proponents in the hallway.